Pericarditis, if you can remember, the heart is contained within the pericardial sac. That sac is, we call it the pericardium. Pericarditis is inflammation of that sac. So what happens? Every time the heart beats, it rubs against that sac. So you're going to hear a grating sound. And what is the patient going to feel? They're going to feel that pain on the chest there. But what you're going to hear is, when you listen to that heart sound, you're going to hear that pericardial rub, that rubbing sound whenever that heart beats. Okay? Endocarditis is that endometrial lining of the heart, meaning the inner lining of the heart. So big thing there is IV drug users. That's the number one type of heart disease they do get. Right? They do get. Big classic symptom they have is that splinter hemorrhage, or that petechiae, or that little pinpoint rash. Cardiomyopathy, usually NCLEX doesn't go crazy on testing you. What's the difference between dilated versus hypertonic? You just got to understand that cardiomyopathy is enlargement of the heart and enlargement of the muscles. That might sound like a good thing. Oh, my heart's stronger. No. The enlargement of the muscles causes an enlargement inwards too, meaning there's less blood volume that can fit, right? There's less volume that can fit, so we can have some defects on that area as well. All right, treatment options, teachings for a patient, they're all going to be they're all going to be pretty similar among all cardiac diseases. Low fat, controlled, limited sodium, which is 2 grams sodium. All right, we don't ever eliminate sodium, so please review that. We don't ever eliminate anything unless it's smoking, drinking alcohol, right? Low fat, low cholesterol, low sodium. For smoking, we got to stop smoking. They got to start exercising as well. If NCLEX makes you choose the type of exercise, it's always going to be aerobic exercise. That strengthens the heart. So aerobic versus anaerobic. So your aerobic's your cardio versus your anaerobic, which is more weightlifting. If you're discussing your aerobic, that's heart muscle, versus the anaerobic, which is the weightlifting, that is more for bone density and muscle formation. All right, hypertension. When we discuss hypertension, there's going to be multiple different types, but you got to remember some key things there. Hypertension causes damage to organs of, number one, high blood flow, and organs that are very sensitive to high pressures. There's only a couple, so let's talk about the main ones. Heart, brain, kidneys. High flow areas right there, high flow areas. So at the end point. Sensitive to pressure, eyes. So at the end, right, at the very end of chronic hypertension, those are the things that can get damaged. All right, medications to treat hypertension. We got your diuretics, beta blockers, ACE, ARBs, calcium channel blockers. Now, main thing to remember about this is, for example, thiazides, that's your diuretic. And you, basically your regular diuretics, your loop diuretics, you're going to be watching out for that potassium release. So is that thiazide diuretic. Your ACE, they all end in what? Pril. The key to pharmacology is identifying the medication based on that name. So pril, anything that ends in a pril. All your blood pressure medication have the same side effect. Low blood pressure. Too much blood pressure medication, low blood pressure. So note down the symptoms of low blood pressure, right? Fatigue, dizzy, syncope. Those are your key symptoms there. Now, ACE inhibitors have one specific side effect that they like to focus on and NCLEX likes to ask, and that is your non-productive cough. So note that down, okay? All right, let's jump into peripheral vascular disease. We got arterial versus venous, right? Arterial versus venous. Your arterial vascular disease, that's your PAD, meaning blood isn't getting to arteries. Take blood from your heart into the area that it needs to be taken. Let's use your hand for an example here. Blood travels from your heart to your hand. If there's an arterial disease, blood's not going to get to your hand. So if your hand doesn't have enough blood flow, what does it look like? Pale, right? There's not enough hair on the arm. It's cool to touch. Your blood pressure, it's a little, your pulse, it's a little bit weak and thready. So those are some key things there. Now, how do we fix that? To let gravity do the work, we want to what? Put that arm up, lower the arm. We want to lower that arm. Make gravity do the work, right? Now, let's reverse that. Venous disease means there's a problem with the return. So blood is getting stuck in that hand. So what is it going to look like? Blood is red, so your arm is going to look a little more red. Or rubor is what NCLEX likes to use. Rubor. Or leathery, red and leathery, brown and leathery. That's what's going to happen to that hand. That edema, because the fluid volume is getting stuck there. All right. So what do we want to do if there's too much fluid in that area? We got to let gravity do the work. So reverse your PAD into PVD. We're going to raise that hand, let gravity do the work there. So very important for you to note that you have your neurovascular check. So I'm going to move forward from here. Now, arterial aneurysm, right? Your aneurysm in general means a burst in that blood vessel or a weakening area in that blood vessel. Biggest thing that causes this, hypertension. And biggest risk factor, smoking, right? So things to note down there. For arterial aneurysm, especially a AAA, which we refer to as an abdominal arterial aneurysm, one symptom that you might see is you can listen to that area and you can hear a whooshing sound, which is the bruit. And if you feel the whooshing, it's a thrill. Listen for a bruit, feel for a thrill, right? In that area. You can even see that pulsation in that abdominal area from those thinner individuals. All right. These are two types of peripheral arterial disease, meaning a lack of blood flow via arteries, and these are more specific. You got your Berger's disease and your Raynaud's. Berger's, just remember the main cause of this. So your main cause is smoking. Smoking causes that increase in arterial blockage there, while Raynaud's is mainly caused by the cold. So people living in cold areas, you got to learn to educate them on how to handle that cold. Okay, so wearing oven mitts when they take out stuff from the freezer, maybe not living in a colder climate. Thrombophlebitis and your varicose veins, they go hand in hand. Their thrombophlebitis is your thrombus forming in not just your legs, but in different areas of the body. And what is the main cause? Usually it's going to be caused by stagnant blood. So the more stagnant your blood is, the more risk for clotting, right? The more risk for clotting. Your gold standard in diagnosing this, ultrasound. We take an ultrasound in that area, we see that clot. And ultimately, the prevention is what? Mobility. Move around. You gotta move that patient around. And of course, we usually, if it gets severe enough, we go the medication route. Antiplatelets, anticoagulants. Varicose veins, those are tortured veins, that little squiggly type of vein you see in someone's leg. Those are varicose veins and usually caused by gravity. So main thing you're going to be teaching your patients or each other as nurses is you got to elevate that extremity when you get the chance. Let gravity do the work. And lastly, if we have problems with that stasis of blood or we have venous problems there, that accumulation of fluid volume can cause an opening, what we call as a stasis ulcer. So biggest treatment there is biggest problem there is going to be that infection. Okay.